Uterine fibroids are a common type of non-cancerous tumor that can grow in and on the uterus. Well, joining us to further understand this is a consultant obstetrician and gynecologist, Michael Agbaji. Thanks for joining us today, doctor.
Thank you for having me. Happy to be here as always.
Well, you can say that again. Talk to us about uterine fibroids. What are they and where exactly do they grow?
Okay, so summary, just as you said, uterine fibroids are benign growths of parts of the uterus. It's described as a monoclonal proliferation. That means a specific cell line or a cell type of a component of the uterus begins to grow abnormally. It does not have features that are suggestive of cancer. Abnormal growth, it grows big, and it contributes to some of the symptoms that you have also mentioned: heavy menses, menorrhagia, issues relating to fertility, pressure symptoms, and a lot of issues like that. So they're basically defined as a monoclonal growth of a certain portion of the uterus, and it's mostly benign.
All right. Talk to us about the prevalence rate. How many people get to have this? What's the percentage?
Okay, so you probably might have heard that every woman has a uterine fibroid. The truth is, it's a common condition. As long as a human being has a uterus, there's a very high possibility that the person may have a uterine fibroids. What now distinguishes them are the ones that become symptomatic, present with the symptoms as you have mentioned, or those that go unrecognized throughout a woman's reproductive life. So it's a very common condition, but it's the symptoms that would distinguish them. In my practice, I get to see quite a number of women who present with uterine fibroids. Probably 3 or 4 out of every 10 women will present with a uterine fibroid. Varying sizes, some may not require any treatment, others may require treatment.
All right. You talked about the fact that some may go on become, some might be asymptomatic, and at the same time, there are those that are symptomatic. Talk to us. Is there something that's responsible for the outcome in different people? Because it would seem that from what you have just said, that the outcome is usually different.
Yeah, so what has been discovered is there seems to be a chromosomal or a genetic component to the origins of uterine fibroids. Okay, studies have shown abnormalities on certain chromosomes. I think chromosomes 6 and 7, then 12 and 14, and this is more common in Black women. You understand? So it's more likely that the fibroids in a Black woman, a Negro woman, will tend to be much bigger than those found in the Caucasians or somebody who's in Europe or the Americas. So some of the factors that contribute significantly to the increased size of these fibroids, in some women in pregnancy, the hormones that support pregnancy will equally support the growth of these fibroids and make them bigger. It has also been said nulliparity, that is for women who have not had children. In this current period which we are, we have a lot of women who are delaying childbearing in order to pursue, career and things like that. So in quite a number of instances, you find out that women who are advancing in age, 30, 35, have not had children, they tend to have more of, the bigger fibroid. It's not to say that women who have had multiple children don't have it, but it's more profound in those who have not started to have children. So another factor to consider is the age at which the uterine fibroids were first discovered. Take, for instance, a female who is having fibroids diagnosed at about 18, 19, or 20. So it's rare in the teenage years, but you can find a woman in her 20, 21, 22, 23, 24 who is having fibroids. So this woman has, a higher exposure to the hormones, that a higher exposure and prolonged exposure of the hormones that will support the growth of the fibroids vis-a-vis things like estrogen and progesterone. Okay, so for those who are diagnosed quite early with uterine fibroid, it's very likely that, by the time she's 30, she's most likely going to have, a really big fibroid. So those are some of the factors. So just as I said, most importantly, genetic or chromosomal factors to it. You never can say which patient is predisposed to having, the really big fibroids, but the mere fact that we're women and we're, from the Black race, the risk is a lot higher than the general population of the world.
All right, doctor. Now, very quickly, I think to a very large extent, your answer to my question has touched risk factors in some way, touched symptoms in some way, and even causes in some way. But I'd like you to very quickly talk to us about the symptoms. When we're done with that, we then go to the specifics of the risk factors.
Okay, so the symptoms, would vary based on the location of the fibroid in the woman's uterus. Okay, just very briefly, the woman's uterus is, about the size of her fist, and the innermost portion, which is described as, or called the endometrium, that's the inner lining where the woman menstruates from. So the further away the uterine fibroid is from that, the less it's associated with heavy bleeding, what we call abnormal uterine bleeding or menorrhagia, in which the woman can have, a normal period should span between 3 and 7 to 8 days, require the use of maybe 2 or 3 pads on a daily basis. However, in a woman who has a submucous fibroid, the duration may exceed 8 days. The volume may be quite a lot. She describes it that she has to use about a pack or 2, of menstrual pads in order to take care of this, as against the former 2 or 3 that she uses. So the heavy periods is one of them. The prolonged period is another symptom a woman can have. You could also have symptoms related to pressure symptoms, okay? The fibroids are growing so big, they are compressing her bladder, makes it such that she's going to the toilet a lot more frequently, or she's finding it difficult to urinate on occasion. It could also occur, if the fibroids are located posteriorly, compressing her rectum. She finds it difficult to defecate, or there's a lot of pain associated with when she has to defecate. So as the fibroid grows bigger, the woman will also complain, I'm observing my tummy is getting bigger. People keep greeting me saying that, yeah, Beja, it looks like you're 5 or 6 months pregnant. So when it gets to that, that's, like a mass effect, kind of. It's getting really bigger. It's a bit embarrassing for some women. Down to, the organ system too. If the fibroid gets really big, it starts to compress on blood vessels. It starts to compress on the ureters, which carry, urine from the kidney to the bladder. And then on ultrasound, it's possible one may start to see things like dilated ureters, dilated kidneys, and such women may begin to come down with symptoms that suggest renal disease or renal failure. Okay, so some people have also mentioned infertility, and that's where there's a lot of talk these days, about fibroids. Do fibroids contribute to infertility? On when we're evaluating women with fibroids in relation to infertility, we would first of all want to exclude any other cause of infertility before we say the fibroid is definitely the cause of the infertility. You do know there's a male factor, there's an ovulatory factor, there's a fallopian tube factor. But a woman who is having, in the absence of any other cause of infertility, a woman who has huge uterine fibroids is having abnormal uterine bleeding, heavy prolonged bleeding. She's having medical issues relating to that. It's very difficult for such a woman to, be in the mood for intercourse, or even a partner who is, trying to have sex with her at, her fertile period, and she's bleeding. It doesn't help in those kind of situations. So a lot of times, yes, the giant fibroids, one may say, yes, it's very likely these may contribute to infertility, because the bigger the uterus is, the bigger the fibroids are. They can actually compress on the fallopian tubes. They can enlarge the surface area that the sperm has to travel through, and in a number of ways contribute to infertility. So most times we would say on their own, uterine fibroids may not be wholly responsible for infertility, but having excluded other causes, then yes, it's a possibility that
Okay.
infertility may be an issue there.